Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Good evening to you, our dear viewers. Happy New Year. Welcome to your week's favorite health talk show, the DOCtalk show. Back in 2022 with a bang, and we hope we will continue to edify you concerning issues to do with your health, because your health is your wealth. And we are back again with our sponsors of this show, National Medical Stores, as well as Camelin Men's Collection. Camelin Men's Collection is located at the Zebra Plaza. That's at the top of Entebbe Road. And this is the year for the men out there to be very, very smart, and that's the place for you to go. And we are here again this evening discussing health. And we are so delighted that our guest tonight is none other than Dr. Omagino, or John, who is the Executive Director of the Uganda Heart Institute. Doctor, you're very welcome to the show.
Thank you very much, viewers. We've come to talk about the engine, the heart.
Wow. Wow, thank you for bringing it up that way. We are here to talk about the engine of your body, and that is the heart. And of course, your host tonight is Dr. Gavin Nyanzi. So excited to be here this evening. Yes, Dr. Omagino, the engine. Uganda Heart Institute. Maybe we begin from there. Some viewers are watching us for the very first time, and maybe would love to know about what's the Uganda Heart Institute, and then you take us away with the engine.
Now, the Uganda Heart Institute is now established by an act of parliament that is in 2016.
Wow.
It is a public institution with a clear mandate of coordinating the prevention and management of heart disease in the country.
Wow.
So it has a national mandate, and the issues really is, one side is a control side, that people do not get heart disease.
Okay.
So we have that mandate of guiding the nation and guiding policy, guiding the line ministry, and generating all the data that is necessary to enable the right policies to be made.
In order to prevent heart disease.
To prevent heart disease.
Yeah.
Because heart disease, 85% of it is essentially preventable.
Preventable.
So we should prevent it before even it comes. Yeah. So the other mandate is now the management. Okay. That is for those ones who have either been born with heart disease, like babies who are born with congenital heart disease,
yes,
or those ones who get it either out of failure to manage their lives, because most of it is via lifestyle changes, or those ones who get it because of collateral damage, or if they have other diseases which lead them to damaging their heart, we have to manage them. Now, before, the story was that everybody had to go abroad.
Yeah.
Right. The mandate of the institute is to develop the necessary capacity to ensure that all management of heart disease is within the country. And in any case, even to position Uganda as a medical tourist destination.
Wow.
Where we can attract referrals for both treatment and rehabilitation, or training, or research collaborations.
Wow.
So the other mandate to be able to drive that through is the issues of training to ensure that we have sustainable human resource
to handle
the disease or the problem. And then next is to conduct research.
Okay.
And nobody will do the research for us.
We have to do it ourselves.
Ourselves.
That's right.
So we have to generate the necessary data that is required to help the country make those decisions. So the mandates, one is prevention through raising those public awareness, informing people what to do, the right food, see the physical exercise, and demanding that the country and all other stakeholders ensure that all our Ugandans, right from the word birth, through primary nursery education, through primary education, through all those post-primary, and even the workplace, have adequate working environment for exercise.
Wow.
So
that is prevention, number one.
Yes.
The number two, mandate for the Uganda.
Mandate is for management of disease.
Okay.
So that one is care. Number three is training. And number four is research.
Wow, that is amazing.
Yes.
Thank you so much for that update. So actually, as a country, we're actually moving forward and forward and forward. So, Dr. Omagino, is really heart disease a big problem in Uganda today, in 2022?
That is exactly why the institution, this mandate and this act was
put
given.
in place.
The issue really is heart disease is already a big problem in Uganda, and it is increasing, unfortunately. The rest of the world, heart disease is the leading cause of premature death.
Premature death, okay.
And even we call it the dialysis and the cause of disability.
Disability.
Yes.
Yeah.
So the issue really is in Uganda, there is a lot of evidence that heart disease is already with us. As we talk, amongst the babies, 1% of babies born every year have heart defect.
1%.
1%. This one is just like any other country,
okay.
And just like any other factory, it has factory rejects. 1% is the rate, and when you transform it in Uganda, we are delivering 1.6 million babies per year
every year
as a nation, and 1% of that one is 16,000 babies born at the Ugandan market.
That's a big number.
So this one is equivalent to 8 very huge primary schools, like Kitante,
Batu Valley, Uganda Road, 8 of them.
8 of them. Our job is to identify all these children.
Wow, that's a big problem.
Plan out, and it turns out a half of them, which is 8,000 babies
every year
are born to our Ugandan market, requiring an intervention. Little wonder, every newspaper you open has a child looking for
funds to go abroad
for open heart surgery. That is an indicator that there is a problem.
A big
problem. In the adults, 1 in every 4 Ugandan adults, whether in the urban
or in the rural setting,
yes, already has high blood pressure, or raised blood pressure.
Wow.
That is a quarter of our adult population. That is a quarter of our working population. It is a big issue already.
Big problem.
Now, as we talk over that one, over 300,000 children, school going especially, have rheumatic heart disease. Rheumatic heart disease comes from infections, and these infections cause the antibodies they form cause damage to their heart valves. These are children who require either surgery for replacement of valves or treatment of, or let me say, repair of these valves.
Yeah.
That is a big problem.
Big problem. Yeah.
Already, the driving factors to this heart disease are things like high blood pressure, things like obesity, already 20% of our women have overweight, which is a precondition. 10% of our Ugandan population are taking alcohol, which is a driving factor. People are taking salt without measurement in all these places around. These are what, so people are not taking enough exercise. All these are big indicators that there is what
there is
a big
problem.
But already, even as we talk, the latest statistics results released show already that about 4% of Ugandans have non-communicable diseases. And heart disease is the leading, then cancer, then you follow other chest infection.
Dr. Omagino,
there's a lot that...
First pause a little bit there. This is quite scary, but I'm glad we are here with a specialist and to bring this information to all of us. And at this point, I'm reminding each one of us that is watching, please, we are airing live on our YouTube channel, the DOCtalk Show. We are airing live on our Facebook channel, the DOCtalk Show. Share this link with your friends. Let them in. Let them get to know this very important information. That will be a big backbone for us as we start 2022. We are taking a short break. We'll be back in a moment.
You are watching the DOCtalk Show.
Our Ugandan story isn't a new one. It's not about where we come from. It's about what can be accomplished when we're working, living, and growing together. It's about speaking the same language, the language of progress. We're Ugandans building Uganda with Ugandans, skilling Ugandans and developing competencies required in the oil and gas sector, partnering with Ugandan businesses to achieve greatness. We're here to build because at the end of the day, we're truly Ugandan.
Pelam Uganda, in partnership with GIZ, has organized the KCOA KHEA Farmers Caravan 2022. Due to take place on 18th February 2022 under the theme Sharing Organic Agriculture Knowledge and Experience. The event will be live on UBC TV from 10 till 11 a.m. Their venue is at Estella Country Hotel, Nigeria.
You are watching the DOCtalk Show.
Wow. Thank you so much for keeping it here with us. Yes, the DOCtalk Show. Please share the link with your family and friends as we discuss the issues to do with the engine of your life, and that is the heart. In studio with me tonight is Dr. Omagino, or John, the Executive Director of the Uganda Heart Institute. And before we broke off, one of the statistics you gave us, Doctor, is that 1 out of 4 of every adult in Uganda is hypertensive. And then the sad bit of it is that 80% of them do not know that actually they have hypertension.
Yes.
Yes, Dr. Omagino, this big problem, the elephant in the room.
Yes, so the real message is that heart disease is there.
Yes, sir.
And it is on the increase. And unfortunately, there is little knowledge about it.
Yes.
People are moving around without checking their pressure. People are moving around without checking their weight. People are moving around without doing enough physical exercise. People are moving around eating anything without a measure. People are moving around without having any medical audit.
Yes.
People are moving around drinking alcohol, taking other corrosives like cigarettes.
Tobacco, yes.
That is tobacco. And even other drugs and weeds and all these other things. But one thing to tell you is that the heart is a machine which God made with all safety measures to serve you for 100 years without breaking down.
Wow.
And if you go into its nitty-gritty, it really does that. It ensures that all the blood that you need, all the oxygen that you need to drive you is delivered to all parts of the body. So it receives all what is used full of carbon dioxide and delivers it completely all to the lungs. And after the lungs, expecting them to be normal, have done all their bit, exchanging, it receives back all that blood with all the oxygen and then pumps to the rest
of the body.
So the heart is very well articulated, and then it has things like rhythm. It has a command post which regulates the heart function. All those ones have happened for 100 years without replacement. It is only for those ones who are born with a defect that we have to pick out, correct, and bring them to normal. And many children who have received opening or heart surgery are here living. They are now at the universities. They are doing very great things. Thanks to this service.
So at birth, everyone's heart is able to take them for 100 years.
The one you have, the package, the way it is able to grow once given the right way, the right conditions to grow. We are talking about nutrition, we are talking about physical exercise. And that is why we are really hammering and saying every institution, our path of, if you look at the life cycle of a human being, from the time of conception, through birth, through childhood, to adult life, it should be given the right opportunity for the full development of this organ, this engine, which is going to carry you for 100 years. And when you reach adult life, you continue to look after it such that it doesn't have to break to
break down. Yes, sir. So what are these issues? How do we make sure that this heart is able to take me to 100 years?
The preventive and other programs and strategies have to come up.
Yes.
The issue is every baby born, or even, in fact, even at the suspicion that somebody is pregnant, that baby should be looked after very well. That is
right from that
normal feeding of the mother, normal exercises of the mother, normal antenatal. The child should be born in the right a place where we can actually examine that child. And when a baby is born in a health facility, every qualified human resource, that is a midwife, a medical, a clinical officer, a doctor, should be able to differentiate a normal child from that one who has a heart
problem.
Many of them get blue quickly. Many of them even find the challenges breastfeeding. Yes. And that midwife should bring out that information and alert
early as possible.
As day one. Day one. And once picked, that child should be referred along the system to health center 3, to health center 4, the general hospital. And the general hospital would have met a specialist, a pediatrician, who should be able to locate it and say when the problem is here, and then can send up through the referral system to the center. And that is what we are trying to sort out. Things should no longer happen by not be left to chance.
It should be intentional.
For a child who is deemed normal, it undergoes these vaccinations. And every time we are vaccinating, there is filled on a card. Is the child putting up weight? And there is a curve. Any child who is not picking up the weight,
that's a danger sign.
A danger sign should be picked and taken for review. For review. When they come to the stage of going to school, we even insist that every child should be examined and a report given.
Yeah.
And that report, doctors, and I'm here looking at the doctors.
The doctors, yes.
Never should you fill a child's form going, say, to school when the child has been presented you with a chance to be diagnosed, and you just fill the thing
Without examination. That's very bad practice.
Use your eyes, use your stethoscope, use everything available to you. Let that child be given a diagnosis if it has a problem.
That's right.
Now, should a child reach school, these children, in fact, as they should not be locked in a house. They should have enough space to exercise. And if the child isn't failing to exercise, it is an indicator
that there is a problem.
With the engine. There is the engine. When the children go to school, then now government policies must operate. Okay. And I'm talking this with seriousness.
Yes.
Our children going to school, physical exercise should be mandatory. No facility should be given a certificate or a license to operate or to look after children when it doesn't have adequate space for physical exercise. Physical exercise is part of the normal growth. As the child acquires knowledge, it should acquire normal growth
as well. Yeah.
As well. It should not, as we are looking at diet, we should look at physical exercise.
Very, very important.
Very, very, very important. So all these ones are planned out.
Yeah.
Even if you are taking your child to boarding, we calculate. We are supposed to have a school health program.
Yeah.
These children should be checked. No school should be opened without a boarding, without a nurse. Or even all the teachers should be able to notice that child, every time there is time for exercise, for it is just squatting.
Squatting, not doing anything.
This child is not active. You should not just look for money. Take that child for the necessary So
examination.
We are saying,
the
country, we have those normal things to look after those hearts. Even when you qualify,
yes,
all employment sites are duty bound to cater for the physical activity of their employees.
Wow.
It is part of the corporate social responsibility. In fact, we should be able to insist, if you are employing a certain number of people, whether it is a market, it should have exercise. Right now you are finding, even in the markets, they are having netball, football competition.
Wow, very good. Yeah.
Even if it is at the community, all communities should have a community center. And that community center should not have only the hall for talking. It should have the physical facility where communities can have the exercises, they can have their what. So if you are an employment, you should have facilities. At the worst, don't load all your health workers or all your people in the boardroom or in the offices or traveling. They go by a van, or they ascend to their offices via a lift. No, let people
walk. Wow.
If as adults you at least do 10,000 steps
a day.
That is a kilometer.
Dr. Omagino, first pause at that point. As an adult, in order for you to have your heart in a condition to take you for 100 years, you need to do a minimum of 10,000 steps a day. You need to check your activity. As you're watching now, please take that torch in your mind. How are you doing concerning your physical activity? Very, very important. We are going to take a short break, and we are going to pick it up exactly from that point. Thank you very much. Please share the link, the DOCtalk Show, on our Facebook channel as well as the YouTube channel, the DOCtalk Show. Share with your friends. Invite them to tune in now for this very important information. Thank you very much. See you in a bit.
You are watching the DOCtalk Show.
Pelam Uganda, in partnership with GIZ, has organized the KCOA KHEA Farmers Caravan 2022. Due to take place on 18th February 2022 under the theme Sharing Organic Agriculture Knowledge and Experience. The event will be live on UBC TV from 10 till 11 a.m. Their venue is at Estella Country Hotel, Nigeria.
My name is Kwagala Betty. I work with Positive Women with Disabilities Uganda. COVID-19 has been a crisis for women and girls with disabilities. For them, they're affected more. These days you find like a young man deny their responsibilities. They don't want to show up that they are the ones who have impregnated women or girls with disabilities. And when we report, following that case is not easy. There's a lot of stigma. Sometimes a caretaker or a family member fear even to mention that a girl or a woman with disability was impregnated. So I call upon everyone not to leave people with disabilities behind.
You are watching the DOCtalk show.
Thank you very much for keeping it here with us. Those that are just joining us, we are here tonight discussing issues to do with the engine of your heart, of your life, the engine of your body, and that is the heart. And in studio with me is Dr. Omagino discussing the heart. And before we broke off, you told us that for any healthy adult to keep the engine well, we must do a minimum of 10,000 steps a day. Yes, Dr. Omagino. The heart and physical exercise. You've really elaborated that. And yes. I hope the listeners, the employers, the head teachers, the commissioners, the parents are all taking note of this very important information.
Yes. Now, the issues we are really targeting the 85%. Prevention is yes. The big message. We should not allow that heart to break down. We have already dealt with the situation of those ones who, in any situation, are born with it. Yes. There should be a mechanism to catch them, yes, sir, and channel them through, and we guide. Now, what we are talking about are really control measures. Yes. Now, let me put it the other way around. To prevent heart disease, we can prevent it at various levels. Okay. Yeah. Yes. One is at personal level, individual level, yes, and that is what we have been talking about. Yeah. This the lifestyle changes. You should be able to have the right numbers. Yes. Through health audit. Know your weight, know your height, know your blood pressure. Those numbers regularly. You should be at least once a year. A year. Yes. Do a medical checkup at least once a year. So health audit. Don't have a file about yourself. Not audit about your money and your assets and your and the car. Yes, but people take their cars to the garage every often, but they never go to hospital to check themselves. So have audit of yourself. Yes. So the issues are at individual levels. What can you do? Okay. The issues of feeding. We are not talking somebody to stop feeding. No. We are saying the body is like a machine. The body is the best accountant. It balances its books every day. Every day, yes. What you put in, you should be able to burn it such that you have zero balance to cause weight. Yes, sir. The moment you have excess and you have a normal liver, it will say, hey, it will change it to a convertible and bankable or storable form called cholesterol. Or fat. And that is fat. Fat, yes. And it keeps it for maybe a rainy day when you may not have enough. But unfortunately, most of these people are taking in so much.
Every day.
You take in breakfast, a certain amount.
Yeah.
Take it, break it with the snacks and egg. Then the very person takes lunch, a certain amount. Then he goes on to take evening tea. And some of these people move to the kafundas, take certain additives, then go home for
something
supper.
for supper.
The married person, how do you come and say, I will not take supper? So all those ones, and yet on their side, the expenditure side, exercise, he moved from home in a car.
Into a car.
He moved from a car into a lift. From a lift to a swinging arm chair and the computer.
Yeah.
Instead of inspecting and looking at he's looking at things from what?
From the
monitor and the
monitor,
computer.
cameras, yes.
Instead of, so all that, one side you are taking in so much, and the other side you are suppressing all forms of exercise. As a result, the body remains with all the food that you have eaten and utilized. And with the normal liver, it changes it to cholesterol, and that cholesterol is what brings problems. It is clogged everywhere. It is thrown. The body, it doesn't have an external bank. It doesn't have an external granary. It doesn't have an external one. It will use the available space under your skin to stuff all those excessive cholesterol. And the issue is in science. The moment you tamper with radius, you have problems of power and flow.
That is with the blood vessels.
The blood vessels.
Once it's clogged in the blood vessels.
So it keeps under the skin, under the what, in between intestines, and when you go to Nakasero, you see a lot of fat in all that one is cholesterol. Even in the human being, you have cholesterol.
Yes, sir.
And the moment it gets clogged into blood vessels, it blocks them, and they start bursting like these pipes of water. And you say somebody has has got a stroke, the vessels to the brain have burst. The vessels to the kidneys have burst. He has a kidney failure, requiring a kidney transplant. The vessels to the legs have burst or they have blocked. Somebody has a dead leg and you have to amputate
the leg.
So all this maiming of a human being is because you failed to balance the input through the mouth with the output through exercise.
Yeah.
So if you cannot exercise, then control what you eat. The body only needs 3,000 calories to run you the day.
In a day, 24 hours.
To do the vital things of breathing, of the heart pumping, of moving you to the toilet, and what. And that one can be got from a very small, put your fist like this. That size of your food, whether it is a meat, whether kalo, whether posho, is enough to drive
you for the day.
Then you add on vegetables and fruits, and then water.
That is sufficient for the day.
And the common man in the village who is eating only those things without these additives, they are the ones living up to 100 years. Then you who are in town, and we have a lot of plenty, are dying at 40, at 50, at what? Premature death, because you are hurt, or you have got a stroke, you have got what? Because you have failed to balance your mouth, what goes through the mouth, with what? So it is a failure, and that is why we call it discipline and life what? Style.
Yes.
Eat healthy. Don't have to eat much. Eat smart. You don't have to eat a whole muungo, a whole cup to stay fat. No. You don't have to be 100 kilos and to look normal. No.
Yeah.
The body is kind. He says your weight is a function of your height. And there is a ratio called 25. Body mass index.
Yeah.
You provoke that, and you have caused the danger to your
to
yourself.
Yourself, yes.
So there is a lot. If you can't, then you can go for guidance. Now, if you have failed to control yourself at that, then you go to institutional.
Okay.
Whether you belong to a school, whether you belong to a radio station, whether you belong to parliament, whether you belong to a bank, that institution should have a corporate social responsibility
for the members that work in that organization.
To say, hey, there is facilities for physical exercise.
Wow.
Some hospital, I went to a bank when I was training in Italy.
Okay.
And their parking yard was 500 meters away from their
offices.
And along the way, they had a very nice walkway, sitting place, flowers, what? Then you come to your office. And by the end of the day, you come and you go, and you have made the kilometer, the 10,000 steps.
Wow.
And for them, they have played
their meta obligation.
Yes. Otherwise, you should have physical exercise. Time should be given. Now, look at our employment sites. Schools have the physical exercise.
Okay.
Universities have.
Yes.
Prisons have. Police have. What about the district headquarters where we are employing many of our
people?
The old ones had the bomber grounds. The new ones have been
schools everywhere.
Now you employ somebody at 25 years. And you are going to keep him to the age of 60, 35 years, without room for exercise, without room for for playing around, without, and you condemning that person to heart disease. So this district headquarters being these schools being established, these institutions should have room for physical exercise, because it is the only way to make use of your excess food.
Wow.
So these are institutions at government level. And
I need to stand up as well.
Yes. Look now at government. We have said the local government must ensure that there is adequate food. The food we are talking about is your energy, carbohydrate giving food. But you have fruits, you have vegetables. So when you are planning a diet for anybody, a child, any worker, anybody, you should have your carbohydrates, proteins, you should have your fruits,
and vegetables.
You should have your vegetables, and then water. How many schools are giving that diet? How many working places are giving that diet?
Wow.
How many? So that is what we are talking about, looking after this. I'm not talking about starving anybody, no. Now let us come to government policies.
Dr. Omagino, you're going to hold it there.
Yes,
policies. Yes. You're going to hold it there. Yes. We are going to pick it up from there after the short break. Yes. But my takeaway from this segment, always just the need that actually your body needs about 3,000 calories in 24 hours. And that is just the size of your fist. That is your carbohydrates, fruits and vegetables, and then a glass of water. Everything else outside that is extra for your body, and you need to find a way of getting rid out of it. And that's the best way, is through physical exercise, regular physical exercise. Special thanks to our sponsors. That is the National Medical Stores, that is responsible for the distribution of medicine around the country, and the Camelin Men's Collection. If you want to be smart this year, those that are planning to attend interviews, please make sure you pass by Camelin Men's Collection. That could be a tick for your next job. We will take a short break and we'll be back in a moment as we continue to discuss the issues of the heart. Thank you very much.
You are watching the DOCtalk show.
Our Ugandan story isn't a new one. It's not about where we come from. It's about what can be accomplished when we're working, living, and growing together. It's about speaking the same language, the language of progress. We're Ugandans building Uganda with Ugandans, skilling Ugandans and developing competencies required in the oil and gas sector, partnering with Ugandan businesses to achieve greatness. We're here to build because at the end of the day, we're truly Ugandan.
You are watching the DOCtalk show.
If you're still here, you're doing a very good job. And for those of us that are 20 and below, then we are sure that we'll be able to be here in the next 8 years. Because we've been told, for every one of us, right from day number 1 or from day 0, our hearts are made by God to last for 100 years, save when you have a defect. But if you have no defect, your heart is made, wired by God to last you 100 years. And our beloved guest tonight, the Executive Director of Uganda Heart Institute, has done a great job of telling us how we can keep our hearts in good shape, that actually we live that long. The ball, as they always say, is now in your hands. And here for this last segment of our show, Dr. Omagino, yeah, you've really educated the Ugandans out there and those even that are living out of Uganda about the heart and what we need to do to keep it healthy. Usually in our last segment we have what we call a call to action, and maybe there are policies in place that would love for Ugandans to know that actually there are issues already in place. This issue is already being addressed even at the national level of government concerning policy. There are policies in place, and maybe you'd also give us some updates from the Uganda Heart Institute. What is on ground for us, the clinicians? What do we have in place actually to make sure that the Ugandans stay safe, especially to do with the engine, which is the heart?
Yes. Now, thank you. Now, this component is now dealing with the last bits which are now at government policy and what government has to do. Now, government, one has given the mandate to the Heart Institute to streamline this. And amongst that, there are activities that have been spelled out. So, apart from this one side of prevention,
yes,
which should be dealing with 85% of the burden.
The burden, yeah.
We now move to the 15%
of the burden.
Yes. Now, the biggest thing.
The 15% are those who have heart disease and
yes,
they need to be worked on, treated.
To be handled.
Yeah.
So the first thing which we really stress and which should all come out is early diagnosis. Early what?
Diagnosis.
Diagnosis. And then you can plan out interventions.
Yeah.
When you pick them early, it takes less in terms of what? Resources. Whether human or facility and other consumables to handle. The issue is if you have hypertension, treat it before it blows your kidneys, before it blows your brain, before it blows your intestines, before it blows your... So, early what?
Diagnosis.
Diagnosis.
Yeah.
So the early diagnosis, everybody we are training. Everywhere you turn, somebody can diagnose hypertension. And the treatment can be got all over.
Yeah.
You don't have to wait for a stroke. You don't have to wait for the what? For the kidney
disease
or failure. Now, the issues through our referral system, as I've been explaining,
yeah,
once anything is picked, it should be gone through the referral system. Now, us as a Heart Institute, we have the mandate of ensuring that that service is not only at the Heart Institute, but it should be spread to the rest of the world, or the rest of the country. So government has established the regional centers.
Wow.
And us as the institute, we are to supervise the regional centers.
So
and
people don't have to come to Kampala, yes, they can be handled at
yes, so as we talk, the 13 regional centers which have been in play, now we are adding on. It was Arua,
okay,
Gulu, Lira, Soroti, Moroto, Mbale, Jinja, Masaka, Mbarara, Kabale, Fort Poto, Hoima, and we relate with the military hospital. Bombo.
Okay.
And then one satellite institution in Kiwoko, it had a pocket of residual disease, okay, this one of endomyocardial fibrosis, okay, which is now dying out as nutrition is improved.
Okay.
Yes.
Wow.
But we had a duty to monitor what was happening there.
Yes, sir.
Now these centers, the 13, government has also given them public universities.
Wow.
It is all of them have except Moroto. Next, these 13 centers have regional hospitals. These 13 centers have also a target for being made city status.
Status, yes.
So, as a government, we have had to combine to ensure that these centers develop where we can combine the care and the academia to carry out our mandate.
Wow.
So the care is the facilities, so we should have super specialists at the regional centers to support the district hospitals, or general hospitals, which should have specialists. And those ones can now supervise the health center, which have medical officers.
Yeah.
Now, these should be the areas where we should be conducting research and training. Link up with the universities, because now we have the universities. So we are generating memorandums of understandings and all those ones to link up all these ones such that we work together to move as the service, training, and to ensure that a child does not have to move from Moroto
to Kampala.
Wow,
that is very good.
A child does not have to move from Kabale to come to Kampala. No,
wow.
A child should not have to move from Arua. No, it should be able to be sorted out. So we are working out the infrastructure. They are working out the programs. Now the issue of training, that is ours.
Wow.
And as we talk, we already have accreditation and the approval by the National Council. First of all, of research.
Wow.
National Council of Science for conducting research. So we have our own IRB on. And with that one, we link up with the international other centers to compete for multi-centered studies and research. And as we talk proudly, we are delivering more than 10 publications in peer-referenced journals, and the last one was in the New England Journal. That one is like getting a gold in the Olympics.
Wow, wow.
So we are training people. Our fellowship program has been approved by the National Council of the National, that is the Uganda Medical and Dental Practitioners Council. Such that the people we train meet the international standards and can be accredited for normal promotions. Because the bigger problem we had the constitution was it was not capturing these super specialized services. And the people who are trained, because we take on people after masters, then we train them for 3 to 5 years. But all that one was not being recognized by the by the public service. And it is like you want very good people who are working at international standards to be able to stop the need to refer patients abroad, and then you are not recognizing them or paying them. So you want to pay them, you want a good service. It is like going to a hotel and you want a nice cake, but you want to retain the money and also demand for a smile when you are not paying them, and you want to eat the cake. It is double what? It is a bit of... So we are sorting out all of that.
Wow.
And now the people we are training are recognized by the international world. And now Uganda also has picked it up and given that recognition. And as we talk, a new service, because public service, we are saying we don't know that service and we are not. So we had no post for a cardiac surgeon, for a cardiologist. And after training all of that, you are ending up being paid like only master's holder. So we have solved that. We have now established, public service has now established and given us what? What
Wow.
is government doing?
As we conclude, I will also stand up to
Yes.
remind our viewers of the need
Yes.
for physical activity.
Yes.
Yeah, so,
Yes,
in
so-
a minute, Dr. Omagino, as we
Yes.
come to a close.
Yes. So the government, first, we thank the government for giving us, for recognizing the super specialty of super specialists.
Wow.
And now public service has given, recognized it as the other service.
Okay.
So with that, we can now get a career path for all our people, and they can progress and
can
get
be promoted.
terms that are commensurate or comparable to the rest of the world.
Wow.
Two is the government has given us this law or this act, and the act is now enabling us roll out the human resource, the national programs, the research agenda. That is a big
Win.
issue.
Wow.
So we can now relate with the rest of the world without them getting worried that tomorrow we will not be there.
Oh yeah. Oh yeah.
When we are negotiating for collaborations and memorandums of understanding, they are doing it with us on behalf of the Ugandan government.
Wow.
So you move with the straight. Next is the issues of the development. We needed infrastructure.
Okay.
We needed these issues. Government has, and here we have to thank actually the president directly. The president directly. He has given us all a soft spot.
Yeah.
He has understood us. The latest has been land for construction of the center to coordinate all this and for all the future developments. That is care, training, research, and even putting up facilities to compete
with the world,
and also to position Uganda as a medical destination.
So special thanks to the president. Yes, availed land. Yeah.
The facilities we have, like this cath lab, because right now as we talk, and let me look at the camera.
Exactly.
Yes.
As we come to a close.
What is the capacity of the institute? By way of diagnosis, in the children, we can diagnose accurately and with all the information that is necessary to guide the treatment and surgeries, 95% of the cases. So there is less than 5% of need of external help in the diagnosis in children. In terms of diagnosis. So if we can deal with it, if we can have, before which was 20, what now we're at 95%.
Yeah.
Amongst the adults, we are at 85.
Wow.
So there is literally no minimal reason to refer a patient abroad for diagnosis. Now by way of treatment, again amongst the children, we are at 85%.
85%.
For the adults, actually it is the reverse. We are almost at 95%.
Wow.
So essentially, technical team we have. The only issue is that it is still a small team. All we need is to widen the team. And that is what we are talking about, expanding the service, training the people more, and that is what we are now using. And now our appeal, first, to the president and the cabinet, we are very grateful. As of now, all we need is approval of the money to fund that project. There is a loan, and there is a cabinet. Anytime it is already prepared, there are funders, everything has been prepared. Yeah. All we need is cabinet to approve, and the cabinet paper and the numbers and everything is there, and then we move to parliament. Now the land has already been given. It is surveyed. We have fenced it. The environmental impact assessment is finished. The soil surveys are finished. National Planning Authority is coordinating the other bodies.
Wow.
Power, we need clean power.
Yes.
We need better roads. We need higher internet. We need a helicopter padding, such that a patient who is
from
Moroto
can fly in a few minutes.
The point is, when you get a heart attack, there's the golden hour or two.
Golden hour.
If you can get you sorted out, reach the area, yes. But we are supporting them through.
Wow. Dr. Omagino, this is very exciting and interesting news. I hope my producer will allow me to invite you again for another show. Unfortunately, our time is running out, but some parting shots to our viewers in 1 minute. But I hope we've all had capacity for handling your heart in case you become careless about it is available in Uganda. We no longer have to go out, as our guest has told us. So it's possible to handle your heart and from any part of the country. So as we come to a close in a few seconds, Dr. Omagino,
one
final message.
Heart disease is with us.
Wow. Yeah.
1 in every 4 adults has a high blood pressure already. 2, heart disease is majorly presentable except for the babies who are born with a defect, and those ones, they are also more than 80% correctable.
Wow.
Next, you can prevent heart disease by paying attention to what you eat and physical exercise. Next is our regulatory bodies, that is the local government, Ministry of Education, and the government as a whole should be able to give guidelines. Schools should provide facilities for physical exercise.
Wow.
Next is, please know the numbers: healthy audit, healthy audit, healthy audit. And finally, the Heart Institute is positioned not only to position, let me say, is in position or has reached the level of position in Uganda, not only in terms of our treatment, but as a tourist destination in the medical field.
Wow.
By way of care, training, and research.
Amazing. Amazing. I didn't want this show to end. And I pray that Dr. Omagino will find time and give us another opportunity to come back and we continue this very sweet conversation. I hope you've heard your heart at birth is designed by God to take you for 100 years. So it's up to you and me to make sure that actually we live out this year, these 100 years. Thank you very much for listening in. We will be back again next week, same time, same place. Special thanks to the National Medical Stores and Women's Collections for making this show possible every week. God bless you. Till we meet again. Bye.
You are watching the DOCtalk Show.